Arthritis is a very commonly used medical term. Those belonging to the medical sector and those in the general public use this word quite frequently. So what exactly is arthritis? Come, let's check it out. I'm Dr. Tony Thomas and you're watching Kallanpally Ayurveda's series on arthritis. The word arthritis is derived from the Greek word arthron, meaning joint, and itis, meaning inflammation. So simply put together, arthritis means joint inflammation. There are various causes for joint inflammation, and hence arthritis can't be said as a single disease. Arthritis is mostly an informal way of referring to a joint pain, joint inflammation, or even a disease of the joint. People of any age, sex, or race is actually susceptible to arthritis. The idea that arthritis is an old man's disease is actually an old thought. But that said, age is definitely a contributing factor for arthritis, along with other factors like diabetes mellitus, obesity, etc. Arthritis is mostly seen in adults over the age of 65. And moreover, its incidence is more in women when compared to men. It is roughly estimated that 1 in 4 adults have some form of an arthritis, and about 40% of those with arthritis have reported reduced range of movements of their joints, indicating activity limitation. And hence, arthritis is often considered as the leading cause of disability all around the world. The symptoms of arthritis usually develops gradually, but many times they may also appear suddenly, like that in gouty arthritis. For different types of arthritis, the symptoms may vary in their type, intensity, presentation, etc. But generally, the symptoms of arthritis are joint redness, stiffness, inflammation, and joint pain. Patients may also experience reduced joint movements also as a symptom of arthritis. The intensity of the symptoms of arthritis can be mild, moderate, or severe, and they may show intermittent or persistent presentation patterns. Some of the symptoms of arthritis may remain non-progressive for years, while some may worsen gradually over time. Chronic arthritis can bring in permanent joint changes like bumpy finger joints, while certain arthritis like rheumatoid arthritis can adversely affect the functioning of the internal organs like heart, kidneys, lungs, etc. Chronic fatigue can also be occasionally seen as a symptom of arthritis. There are various contributing factors or risk factors for arthritis. They are being overweight or being obese, joint injuries, infections like staphylococcus causing septic arthritis, specific occupations, smoking, age, gender, inheritance, etc. can be considered as the risk factors or contributing factors for arthritis. Excess body weight will always contribute to either the onset or progression of arthritis, since those joints are always under consistent stress while supporting that excess body weight. Joint injuries mostly leads to post-traumatic arthritis, especially if not well rehabilitated. During a trauma, the articular cartilage present in the joints are damaged, and hence cartilages becomes less capable of withstanding the stress, thereby leading to arthritis. It is considered that almost 12% of those with osteoarthritis have a history of previous trauma. Various sources of infections like bacteria, virus, or fungus can trigger an arthritis. The most common among these are the infections caused by Staphylococcus aureus. Such types of arthritis occur suddenly and are very painful. These infections can quickly cause damages to the joints involved. Certain types of occupation, which involves repetitive bending of the knees, squatting, or weight bearing, can bring about accelerated degeneration of the joints, or can also increase the chance of an injury leading to arthritis. Toxins from smoking contribute to cartilage loss, and it may also retard the cartilage repair due to the high amount of carbon monoxide in the blood. Moreover, smoking pumps in higher amounts of free radicals into the blood, causing inflammation of various tissues. As age progresses, our body degeneration also increases, and so do the chance for development of arthritis. According to Ayurveda, arthritis can be generally included under vata rogas, that is, those diseases which are caused due to the aggravation of vata dosha. Vayohoratri bhuktana te antamadhyadiga kramat, that is, as age progresses, the vata in our body increases or gets aggravated, and thus the chances for developing the vata predominant diseases like arthritis also increases. Though exceptions like gouty arthritis are present, it is generally found that the prevalence of arthritis is more amongst women than in men. The presence of estrogen, lower joint stability, weight gain post-menopause, etc. are generally considered as the cause for such a presentation. Though not confirmed, it is very likely that there is a genetic component to arthritis. Having a very close relative with an arthritis like rheumatoid arthritis increases a person's risk of developing the same. But that said, the pattern of inheritance in such cases still remains in the muddy waters, but family history do raise the risk of developing arthritis. According to Ayurveda, the body is controlled by the three dosha, or the three bioelements, namely vata, pitta and kapha. It is the function of the vata dosha to bring about body movements, and hence arthritis is generally included under vata rogas, or the diseases which are caused due to the aggravation of vata dosha. Since arthritis is the inflammation of the joints, it can be better correlated to the Sandhigata Vata rogas mentioned in Ayurveda. The Sandhigata Vata rogas means the rogas which are caused due to the aggravation of Vata doshas in the Sandhi or the joints. Vata Purna Dhriti Sparse, Sofa Sandhigato Anlaha, Prasarna Agunjanayo, Pravartim Savedana, which means when Vata dosha aggravates and positions itself in the Sandhis or the joints, it causes joint inflammation so as to feel that it is filled with air. Moreover, such a condition makes the joint movements like flexion and extension very difficult due to the presentation of pain along with such joint movements. For more details on arthritis, do watch our upcoming videos in the series of arthritis. Please do like, share and subscribe our channel, and don't forget to click the bell button to receive timely notifications. Thank you.